Today, there is one new case of COVID-19 to report, who is in managed isolation in New Zealand. The person who tested positive is a woman in her 60s. She arrived in New Zealand on the 18th of June. She travelled on an Air India repatriation flight, and the code for all such Air India flights is actually the same, AI 1316. So this woman has been staying at the Pullman Hotel in Auckland. Obviously now she is being confirmed as a case, the usual protocols, and she has been transferred to the Jet Park quarantine facility late yesterday. So yesterday, as many of you will know, our laboratories processed 9,174 tests, our highest day of testing since we began. That includes testing undertaken in the managed isolation facilities as part of our around day 3 and around day 12 protocols, as well as testing across the community. So there is not only good capacity for us to do the swabbing across our communities, but also, of course, our labs have that really good capacity to process the tests. We have already one of the strongest border systems in the world, with people coming home and required to stay in managed isolation or quarantine for that 14 days. That remains, as I said yesterday, the mainstay of our border measures and has been in place since Cabinet's decision on the 9th of April. We've had more than 20,000 people through managed isolation facilities with no evidence of any spread from there into our communities. And in addition, people departing managed isolation must now return a negative test prior to being released from managed isolation. They can refuse the test, and we then have the potential to require them to stay for another up to 14 days. Since the 16th of June, when we had the 2 cases a week ago, for the 2 women who had reported back from the UK, starting from the 16th of June, there's been more than 45,000 tests completed in New Zealand on that day and on subsequent days. And as you will be aware, the only cases we have detected are the cases who are in managed isolation facilities. However, those 2 cases did draw all of our attention to a gap that was there in the system between what we expected was happening, the policy intent, and what was happening on the ground. We moved quickly, immediately, in fact, to remedy that and ensure that those leaving managed isolation were also being tested in addition to completing their 14 days. We also began following up with 3 groups to ensure all our bases were covered as an extra precautionary approach. And the first group was those who had received an exemption to leave managed isolation on compassionate grounds. That's the group of 55 who left between the 9th and the 16th of June. And one of these people subsequently had their approval withdrawn and so remained in managed isolation for the 14 days. And I'm just going to hand over to Kiriana, who will talk through a little bit more detail about that remaining group, the 54.
Kia ora koutou katoa. So 55 people left managed isolation on compassionate grounds, either to self-isolate in the community or to make visits into the community. 34 people were granted an exemption to attend the funeral of a family member or grieve with family. These people either returned to the facility or self-isolated in an agreed location. During this time, the guidance changed to allow people to leave managed isolation to go and grieve in the family home. Applications received prior to that date were for attendance at a funeral for a loved one. 16 applications were granted to self-isolate with a family member who was close to dying. 4 applications were granted for day visits to see a family member that was close to dying. These people returned to managed isolation each day. 1 person was granted an exemption because of a terminal medical condition. These group of people were granted exemption from managed isolation for exceptional circumstances. As part of leaving managed isolation, all signed a health release that required them to follow a set of protocols depending on the category of exemption. These protocols were dependent on the type of exemption and, of course, personalised to individual situations. Types of protocols included undertaking a test for COVID-19 at a CBAC, travelling directly from managed isolation facilities to the agreed address without leaving the vehicle, wearing PPE, including gloves and masks, when spending time with the family member that is dying, complying with all Ministry of Health COVID-19 guidelines, staying 2 metres apart from people outside of their bubble, washing hands regularly with soap and water for 20 seconds or clean with sanitizer, coughing or sneezing into tissues or their elbows, and washing their hands with soap and water for 20 seconds or clean with hand sanitizer. Not attending supermarkets, shops, petrol stations or any other similar services during this time. Accessing hospitals and GPs for personal care was allowed. Providing those facilities were advised before or on arrival that they were in approved self-isolation. Ministry has been in communication with all of these people since they have left the facility. Of these people, 39 have returned negative tests for COVID-19. 2 of those had had a test prior to leaving managed isolation, and another 2 were tested the same day as leaving, meaning 35 were tested after leaving managed isolation, with most tested while still in self-isolation. 11 will not be tested, either on the basis of health, because they are a child, or they have left the country. This is an increase of 4 from yesterday, due to a family being unable to be tested at this time. 3 are waiting results. 1 person we understand to have had a test is now not returning contact, and this has been referred to enforcement.
Thanks, Kiriana. And as I said, Kiriana will be able to assist with answering questions about the 55 people. So going back to the U cases, the next group we went to were those who may have been in proximity with the 2 women who had returned from the UK. Again, we took a very precautionary approach to this and followed up a much wider group of people than we normally would for a confirmed case, whether in managed isolation or in the community. Of the guests in the Novotel from the 6th to the 13th of June, which was the time period the women were there, we had 6 possible contacts outstanding yesterday. 1 of those has now been contacted and referred for a test, and 5 have been referred to what we call enforcement services. But this is a team in the ministry that then follow a process. If necessary, they will ask the police to assist in finding people. We can call on the police if necessary. And of the staff from the hotel, of which there were many, only 1 remains outstanding, and the hotel continues to follow up with this person. Again, just to reiterate, these are people who were in the same facility as the 2 women, and this is part of a wider precautionary approach. So we move to the 2,159 people who left managed isolation facilities from the 9th to the 16th of June. That group includes most of the 55 people granted compassionate exemptions, as some of those who were doing day visits out may have left finally after the 16th, but many of those people are within that 2159. Since the 9th of June, we have been rolling out the testing in managed facilities around day 3 and around day 12 of people's stay, as you know. Said it plenty of times. Prior to that, it was not a requirement. However, we are following up the balance of the people in this group to check on them as part of our broader precautionary approach and to close the loop. In addition to checking them, we're referring those who haven't had a test to go and have a test. And I'm going to provide you with the numbers. And I just want to reiterate, the reason I haven't provided you with the numbers is not because I've been trying to hide anything. I simply haven't had them, but the team have worked hard to get as up-to-date numbers as possible, and I will update them on a daily basis. So, to date, 1,010 have been contacted and we know have tested negative for COVID-19. Of those, 800 were tested before leaving managed isolation, and the remaining 210 were tested after departure from the facility. So, for those of you who don't have a calculator on your phone, 800 represents around 37% of the total number. And that is our starting point, because as we contact and follow up with all those other people, we expect that proportion will grow. Then the 210 subsequent ones, that represents another 10%. So there are 239 people who have been referred for a test that we do not have a result for yet. So again, we know that there are 1,010 who have had a test and we have a negative result. Another 239 referred, and we don't have a test result yet, but we are following those up. We're still in the process of connecting with the balance, which is 791. The process there is a text first, followed by a call, followed by another 3 calls, and we are following them all up with a 5th call today. We also use our finding services, customs and police, to see what data they might have on these people. And obviously, as we're now matching with NHI, we can get up-to-date contact information if it's there as well. There are also 119, which is about 5% of the people, who will not be tested because of reasons such as being a child, and we don't feel it's appropriate, being part of a repositioning crew for a ship that is here. So we have some crews come from overseas, they move very quickly through and off to their ship. And some of these people have now returned overseas, so they came and went back, and there are some who are refusing a test. So I just want to summarise, we're doing everything we can, including providing information as it comes to hand to assure New Zealanders these people do not pose a risk to their community. And I want to emphasise again that aside from those who have the compassionate exemption or who have gone offshore, they have all completed the 14 days consistent with international evidence, and so the risk they pose to the community is very low in the first place. However, we are following them up and referring them for testing as part of closing the loop. We've taken strict action to strengthen our systems, and as soon as we became aware from the 16th, of course, everybody is now being tested. I will update daily on these numbers as the work progresses.